Tonight, I am also calling on this Congress to repeal and replace Obamacare with reforms that expand choice, increase access, lower costs, and at the same time provide better health care.
Well, that was a whole lot President Donald Trump promised last week when he spoke to Congress. Now the Republicans have released their plan to repeal the Affordable Care Act, and critics are already saying it doesn't do any of that. That's right. Last night, the GOP dropped the plan. It will repeal the penalty for those who choose not to purchase health care, and it would replace subsidies with a tax credit. But it will keep the Affordable Care Act's popular provisions, such as covering those with pre-existing conditions and allowing children to remain on their parents' plan until the age of 26. House Speaker Paul Ryan said the bill will, quote, drive down costs, encourage competition, and give every American access to quality, affordable health insurance. This unified Republican government will deliver relief and peace of mind to the millions of Americans suffering under Obamacare. Except there's a little problem. The Republicans aren't sending anybody out today to talk about the plan. Maybe it's because it's expected to cover fewer Americans, and it's unclear how much the plan will cost overall or how it will affect coverage. Keep in mind, House Republicans also prevented the Congressional Budget Office from actually releasing that kind of information. I wonder why. Now, they're hoping to fast-track the bill to get it to the floor for a vote within weeks. You got a better chance at Donald Trump showing up to Essence Music Festival than that happening. Joining us to discuss the House GOP bill, Democratic Congressman Bobby Scott of Virginia. My panel, Rena Shaw Barara, Republican political strategist and consultant, Ma Rocky Moore, President and CEO, Center for Global Policy Solutions, Angela Rye, Principal CEO, Impact Strategies. Congressman Scott, all right, so they released the plan late last night, not a big rollout. Anytime you release it this way, it's sort of like you really don't believe in your own plan.
Well, one of the problems, as you pointed out, there's no CBO score. That could separate the press releases from reality. One of the things that they've been getting applause lines by saying they're going to repeal the Affordable Care Act and replace it with something great, and right to this point haven't had anything to put up to show what they can do. There's one part of it that is makes the thing, in my judgment, just unworkable, and that is they try to cover pre-existing conditions without a mandate. If you can wait until you get sick before you buy insurance, then people will wait until they get sick before they buy insurance, and it spirals out of control. That is not theory. That's what they tried in New York. The prices tripled. That's what they tried in Washington State. Got so bad that nobody could buy individual insurance. So how they can provide cover pre-existing conditions without a mandate is going to be a thing to behold, and CBO would have exposed that. It's down to arithmetic. If they're going to reduce cost, the only way you can do it is reduce benefits, call out a healthy group. But in any case, if some are paying less, others are going to pay more.
Also, in this particular plan, what we're seeing when it comes to some critics will say it's a huge tax break for the wealthy, and they also are hooking up CEOs, allowing corporations to deduct the salaries.
It's a great. They eliminate a lot of taxes that are tilted towards the wealthy, so they get a big tax break. If you eliminate the taxes, how do you pay for the program? If they give less subsidies, that means people will have a harder time buying insurance. Fewer people will end up getting covered. They're cutting back on Medicaid. Fewer people are going to get covered. And so you're going to have less coverage, fewer people covered, and a possibility of the whole thing spiraling out of control.
Rena, we go to the states that Trump won, West Virginia, Ohio, Kentucky, and others. They're going to be hit hardest. All those broke white working class folks who voted for Trump, guess what? Hashtag we tried to tell you.
That's right. And those senators have already come out and said we have huge concerns with this. They saw a February 10th draft in Politico, and those senators spoke out yesterday, 4 of them, Murkowski,
they saw a draft on a website.
Oh, that's right. But already they said we're seeing deep concerns. And so this is not good for what was unveiled yesterday. Essentially, conservatives and moderates are split. This is deep fractures, and they have to figure out a way to keep the expansion of Medicaid stable. And that's what these senators, Capito, Murkowski, Gardner, and Portman, are saying. Don't do it. Don't do it this way, because it's not going to help our states. So you see people in the Senate standing up, 4 of them. That doesn't leave very good numbers for the House. 19 nays could sink this thing.
Maya?
So I think that the plan is designed to fail. The fact of the matter is that the math doesn't work, but also it's mean-spirited. I mean, it undercuts low-income people, it undercuts women. I mean, the fact that it's deliberately defunding Planned Parenthood is a shame. And Planned Parenthood provides more than just abortion services. It provides health care for women across the country. In Texas, when they defunded Planned Parenthood, you know what happened? Maternal child deaths went up dramatically in the space of a few years. So what we're looking at is a plan that is not only designed to fail, but a plan that will actually undermine the health of the American people.
Angela, this is, I mean, look, critics are saying this is really about hooking up insurance companies as opposed to folks who need health care.
Sure. I think one of the most interesting things that keeps playing over in my mind is my last president. I haven't had a president since he left. Barack Obama saying, you show me your plan, and if it's better than mine, I'll support it. I'll go out and champion it. And it's like you keep hearing this over and over in your mind. You know that the Republicans tried to repeal Obamacare without a replacement over 60 times. And lo and behold, here we are with a far worse plan, and one that is designed to hurt the people who went out of their way to vote for this man who is not supporting their interests, and they are trying to vote, or they tried to vote their dreams, and now it's failed them.
Congressman Scott, a Republican said that President Obama did not make it bipartisan to pass the Affordable Care Act, that there was no Republican input. There was absolutely no Democratic input on this plan.
Republicans were welcome. If you go back and listen to what people were saying back then, we were told that there was nothing that we can put in the bill that a Republican would vote for. They had decided on inauguration night not to support anything the president did. And so to suggest that it's our fault that they decided to oppose everything, we passed what is essentially a Republican health care bill. The Democratic plan is a single-payer plan. This is the Romney Care, what the Heritage Foundation had recommended. But let's see what their so-called improvement will do. It'll fail because they're trying to cover pre-existing conditions without a mandate. That means it'll spiral out of control. We know that because several states have tried it. Low-income people are hurt because if you have subsidies the way they're structured, low-income people don't get enough. You spend too much subsidies for higher-income people that don't need it. What will this thing cost? They don't know. In the information they released last night, they said they're working on it. They don't know.
I agree with you, Congressman. It's deeply troubling that we don't know the cost. I mean, Republicans are becoming hypocrites in this moment, not knowing. However, well, you know, but one thing is they are saying they are going to put an income cap on those tax credits so that the wealthy Americans will not be able to.
Well, they don't get it. They don't get that now. Are the credits going to be more or less than they are now? I mean,
that's what we don't know.
Well, it's arithmetic, because if low-income people don't get enough, they're not going to be able to buy the insurance. They're going to lose their insurance.
It's going to be a whole bunch of mad. It's going to be a whole bunch of mad, broke white folks, and these town halls are going to get even more crazy. So, all right, we'll see what they do. It's not going to get passed in a few weeks, so we'll probably be talking to you a little bit more. Congressman Scott, we appreciate it. Thanks a lot.
Thank you.
A peaceful protest turned deadly. 37-year-old black man was shot and killed by Baton Rouge police. His hands are in the air, and you still get shot by the cops.
Oh my God, please don't tell me he's dead.
We're not going to let hate define us.
Race is a big part of this.
If truly all lives matter, then all lives need to matter equally.
What we require is action. What we require is accountability. We understand that black lives do matter, and we will keep focused on this issue.
NewsOne Now, every weekday morning at 7 on TV1.